Let's talk about facelifts, Dr. Shenker,
Sure.
and how do we ensure that they look natural and not scary?
So a facelift, it's not that different from any other operation. Sometimes people have to realize that too much of a good thing is a bad thing. So a facelift, you need to put the tissues back where they belong, but not too high. You need to add some fat, but not too much fat. You need to bring the skin back to where it belongs, but not too much. And so it's a question of judgment, it's a question of experience, and it's a question of understanding patients' expectations. I do sometimes have patients that will say things like, make me look tight, and I don't do that because it sounds great in theory, but in practice it's really not. And so, all things in moderation, like with any other operation, it's always easier to go back and make something a little tighter if you need to, whereas if you go too far the other way, you're really in trouble and it's hard to go backwards. So that's sort of the philosophy we like to keep in mind. And I've yet to ever have a patient who says, I want to look fake, or I want everyone to say, hey, who did your facelift? Like, that's not our goal. Our goal, which we hear all the time from patients, is when they say, I went back to work and people say, hey, are you just coming back from vacation? Or you look rested, or are you sleeping well because you look better? That's the goal, not, wow, your face is tight. So we're never aiming for that.